typically stretching trauma. The only way to injure a ligament is to stretch it beyond its normal range of motion. And the trick is understanding that. So it's going to be trauma. Now, this is really important for you to understand, because half the people who come in to see you, you're going to say, how did you hurt your back? And they're going to say, I picked up my granddaughter. I picked up something off the floor. I rolled over in bed. Are these traumatic things? They are if your joint is trashed. And you're going to have to communicate to them that the reason they're in pain is from an accident 30 years ago that decayed over time and got their back weighted until their back became so weakened that it popped and it reached the bending over. And what's funny too is I can lift a 300-pound weight and then I can turn around and grab something and throw my back out. How is that possible? How can I lift 300-pound deadlift, no pain, and then I reach over to pick up my purse and I throw my back out? How is that possible?
Positional pain.
It's positional pain. When I twisted like this, I stretched the tiny, it only takes one piece of scar tissue to snap. And when I twisted like this, my disc shifted. It put stress on, because the whole disc isn't injured, just one piece of it. Maybe the whole disc is injured, and then one piece snapped and it was a cascade after that, right? I can lift huge amounts of weight with this arm. You can hit me, you can do whatever you want. If I put it right here and put stress on the one bad spot and you give it a little tweak, does that make sense? So when you hear stories like this, when you hear stories of, yeah, I worked hard all day and then I did this and I threw my back out, you're going, it's ligament. It makes sense, right? And then any questions about trauma? So, and we'll teach you this when you're doing your history. You always say, when did this start? They tell you. If they don't tell you something traumatic, and again, picking up a purse can be traumatic depending on how you do it, you have to go learn how to go back in history and find trauma. It's very important that you get them to acknowledge that they did have trauma in the past and help them understand that their current condition is a result of trauma in the past. And then I even chew them out and I'm like, too bad you didn't rehab it back then. Now your joints are falling apart and I get to make a whole bunch more money off you because you screwed up 30 years ago and didn't take care of it the way you were supposed to. See? And they look at me and go, okay. Right? Make sense? Because I'm telling them the truth.